This video will review a lumbar manipulation technique in a supine position. We will demonstrate the technique all the way through, then break it down step by step. Begin with your patient aligned towards the edge of the table. Move their feet towards the opposite edge of the table, crossing one foot over the other. Ask the patient to wrap their arms across their chest. Side bend the patient's shoulders and upper trunk away from you, then rotate the patient towards you. Place your upper hand over the patient's scapula to maintain the upper trunk position, and place your caudal hand comfortably over the patient's ASIS. Gradually roll the patient towards you, pulling your upper hand until you feel the ASIS begin to rise from the table. Take up any remaining slack by pushing through your lower hand. Provide a rotational thrust towards the table through the ASIS with your lower hand while stabilizing with your upper hand. There are many modifications for this technique to make it more suitable for your patient's body type or your body type. If you have difficulty performing the upper trunk positioning, you can pull to side bend the patient towards you and rotate them away while standing on the opposite side of the table. Maintain the position and walk around the table to perform the rest of the technique. If you are having trouble maintaining your patient's upper trunk position, you can increase the surface friction by asking your patient to remove their shirt or placing Dyson between the table and their lower shoulder. You can also use Dyson between your hand and their scapula to maintain placement of your stabilization hand. For an alternate hand position, have the patient interlace their hands behind their neck and adduct their shoulders to approximate their elbows. Weave your upper arm through the space in the patient's upper arm. Extend your elbow to allow your hand to reach the plinth. This arm becomes your stabilizing arm while you provide thrust through your lower arm. Now we will put the steps together and show you the technique all the way through.